I'd like to begin by defining ALICE for you. ALICE stands for Asset Limited, Income Constrained, Employed. This pandemic has really placed a heightened focus across our country on those workers who are essential to our economy. I'm talking about our healthcare workers, our first responders, people we run into every single day, our grocery store and delivery service employees, and so many more in our region, right? So which of these people that I just described have you interacted with in the past few days? Who is your most essential ALICE or your ALICE hero? Please enter your comments in the chat window for a moment. Take a moment and enter those right now. Who is your most essential ALICE or your ALICE hero? I see someone saying an Amazon delivery man, grocery store clerk. Really great suggestions. Another one around Starbucks barista. Some of your family members, right? Amazon delivery postal workers, grocery store, food delivery folks. There are so many USPS, gig members, club members, a whole host of folks who we would deem as our ALICE heroes or our essential ALICE. These are all people who are essential to maintaining our infrastructure, right? And our operations that allow us to navigate our lives with ease. But the key is they can't afford the essentials like housing and food, healthcare, childcare, and transportation. Some can't afford a smartphone, right? So the Maryland ALICE report, commissioned by a group of United Ways in Maryland, helps us really understand better the obstacles they face and why, most important. We've just released the latest version of this report, which reveals why ALICE households can't make ends meet. It's our third such report. Our first was issued in early 2017. I see there are currently 222 people on this call, and joining us today is an esteemed group of panelists to really help us understand the implications of this report and how this report can be used to improve lives for families and individuals who really struggle every day to keep a roof over their head, right? To really make sure that food is on their table and to keep their kids safe and healthy. So we'll go now to our panelists and welcome them. First, we have Stephanie Hoops, the National Director of United for ALICE. Welcome, Stephanie. Secondly, we have Celeste James, who's the Executive Director of KaiserPermanente Public Health. Welcome to you. And last but certainly not least, Sarah Fitzusnetz. She's a principal researcher, University of Baltimore, Schaefer Center for Public Policy. And also an interesting point about Sarah, she also served in the past on the Research Advisory Committee for the Connecticut ALICE report. Welcome to you, Sarah. So that our pandemic is right before us, we see it clear, front and center. Before we start talking about all of the details, I just wanted our audience to get to know each of you a little better, right, as our panelists. I'd like each of you to think about this. I'm going to ask you a question about how current events have affected your life, either professionally or even professionally, or both. We'll start with Celeste, go to Stephanie, and then to Sarah. So Celeste, tell us, how have you been impacted by the current events?
Good morning. Thank you, everyone, or good afternoon, rather. Thanks for that question, Franklin. You know, obviously coronavirus has affected all of us in some way, and I have to start by saying that I'm extremely grateful that I have not been personally affected by it. I'm in good health, my family's in good health, and I am blessed to be able to work from home safely, and so that's a great thing. I've also been, you know, had the privilege of working in healthcare and working really essentially on the front lines. I'm not literally on the front lines, but working for a company that is on the front lines of providing compassionate care to people who have contracted the virus. And we've also been supporting communities. So I've been very deeply embedded in understanding the disparities that we've seen with COVID-19. And of course, we're not surprised to hear that communities that have already been burdened by poor health are even more burdened by coronavirus. And so that has really taken hold in my world and is really trying to understand what does that mean for us in healthcare and in public health, and how do we address communities that are at greatest risk for contracting the virus and dying from it. So I'm really happy to be representing KaiserPermanente on this panel to address potential solutions and really look at these issues.
Thank you so much, Celeste, for sharing how you've been affected by this. Stephanie, how has this pandemic affected you personally?
Well, a couple ways, professionally and personally. I know, like most of you, your world has been turned upside down and we're all doing new ways of working or not working. And in the middle of this, it just hit me so hard that Alice is smack dab in the middle of it. Alice was vulnerable before the pandemic and is being hit really hard now. Alice is disproportionately Black, so as the new heightened focus on racial inequality, Alice is right there in the middle of it. So our work is more urgent than ever. And then personally, I had an emergency appendectomy in the middle of the COVID crisis. And I have new Alice heroes who were the healthcare workers who were, risking their lives and their family's health to take care of me. And I came through with flying colors, so I thank my Alice heroes for that.
Thank you so much. I think we all are glad you came to the point of being whole and healthy and on this call today to share with us. Thank you for sharing. And Sarah, what can you share about the impact of COVID-19 that's had on your life so far?
Well, thank you, Franklin, and thank you for everyone being here today. Professionally, it's just really reinforced the importance of the work we do at the Schaefer Center with analyzing and evaluating policies and programs, especially as we get more and more understanding of what the budgetary impacts are going to be at the federal, state, and local level. The restriction, the fewer funds that are going to be available for programs really means we're going to need to do the most effective and efficient policies possible. Personally, I also have been fortunate to not personally have COVID-19 yet, but having family and friends scattered around the country, you worry about them just in general, and then whenever a new hotspot comes out, that the worries focus on those folks in that area especially. So every few weeks, it's just another group of my friends or family who I really am worried about, in addition to just worrying about, being concerned about everybody during this time. So.
Yeah, thank you so much, Sarah, for that. And thank you, Celeste, Stephanie, for sharing with us today how you've been personally and professionally impacted. I too have been impacted by the pandemic. Professionally, I've learned so much about the power to reimagine how you deliver services and how you fund other nonprofits and how you collaborate with other foundations. So much I've learned in this short window of time since mid-March. Personally, one of my brothers who lives in Houston contracted the virus, was in the ER, was in critical care. Fortunately, like you, Stephanie, he is now at home doing much better, but it really came home personally for me, and dealing with the issue locally was really, really difficult as it is, but then personally when it comes to your brother, right, someone that's close to you like that, and to see him come out on the other side in a favorable way was very gratifying, but also was very difficult, right? So thank you guys for sharing. The next thing I'll just share is in reference to the Alice report. The Alice report, it shines a spotlight on the large and really increasing number of households in this state that don't make enough to pay all the bills, right? These are hardworking people, but they're working in low-paying jobs and their earnings just cannot keep pace with the state's high cost of living. So here in Maryland, 39% of state residents are Alice households who can't make ends meet, right? That represents a staggering 2 out of every 5 households in the state. And so now we have a question for all of you. We have a question. So when we think about this number of Alice's, right, that are in our various counties, how much do you think a family of 4 need to earn to survive in Baltimore County? So 2 parents and 2 school-age children, right? What does a family of 4 need to earn to survive in Baltimore County? Take a second to respond to this poll, it should be up in a moment, and give us what you think the correct answer is. What does it actually take for a family of 4 to earn to survive in Baltimore County? We'll see if you can just respond to the poll that's going up now. all right? You see different numbers, 65, 70, 100, 85, 78, different numbers, right? So the answer is that the amount needed to just make ends meet in Baltimore County is $77,000 for a family of 4. And if the children were both in childcare, the family would need to earn $92,000. So very fascinating numbers when you think about what's really needed to really make a difference in taking care of your family budget. So Stephanie, tell us why. Tell us why this report is so important.
So the ALICE data provides some facts at a time when there's a lot of opinions going around and a lot of emotions. And the household survival budget is just what you were referring to. We break that down, we make it transparent, and then it provides a concrete measure to compare against jobs in Maryland, as well as other measures that have been used for financial hardship, specifically the federal poverty level. And you can see how woefully short they are with the reality on the ground. Also in comparison, the federal CARES Act stimulus check only provided about half a month of, covered about half of a month's expenses for an ALICE family. So while helpful, it was limited in its effectiveness. I think it would also be helpful to see how COVID is impacting an ALICE family financially. So let's look at before the pandemic started. Here's a family of 4 with 2 children in childcare. The dad is an automotive service technician earning about $23 an hour, and the mom works in a small retail business in town earning about $12 an hour. So before the pandemic starts, just their regular covering all their costs, they earn about $7,300 a month. Their income is about $5,800 a month. Their expenses are $73,000. So in the first 2 months of the year, they're in debt by almost $3,000. So I'd like to ask folks, going through the impact of COVID for the year of 2020, what do you think their cumulative debt is at the end of the year? So if you can fill in the survey, and we'll see who gets it right at the end of the year. Give you just another moment. All right, so let's see what this scenario shows us. Can we have the next slide? So the pandemic hits in March. Both the auto tech operation and the small business in town pulled way back. So both parents were working half-time. And the family's debt doubles to almost $6,000. Then in April, there's a lot of moving parts. They continue to work about 15 to 25 hours a week. The child care cuts back their hours, and then the parents aren't sure. They want the kids to stay in terms of safety. And then with limited work, they pull the kids out of child care. They get a great boost with the stimulus check, which totaled $3,400. But by May, their income was well below their expenses, and their total debt for the year so far was $7,000. Work continues through the summer, but only 15 to 25 hours, and it's variable week to week. It's very hard to plan. They face challenges with the kids without childcare, and the rent is getting harder to pay. They're looking for ways to cut expenses, maybe looking for new health insurance. In the fall, the economy picks up a bit. And the work hours increased to about 25 to 30 hours a week. Next slide. But the bills are adding up. They're considering canceling their health insurance, but they're worried about getting sick. So by the end of the year, even with a little uptick in the economy, they end the year in $20,000 in debt. So for all of you who guessed that, you got it. I did see a couple of those in the chat, so well done. But that's a really tough story for a family of four.
Thank you so much, Stephanie, for the very powerful information that you shared with us, and for also showing us how this pandemic, right, will further impact Alice households. So I'd like to offer our sincere thanks, honestly, to KaiserPermanente, our very generous corporate partner in the Maryland Alice Report. This report will be used to inform our decision-making, our programs, and will be shared freely with others, including lots of nonprofits and other organizations, to really just assist and aid them in their work. Thank you, KaiserPermanente, for making the report possible. And thank you so much to all our other partners for their support along the way. So Celeste James, why is the Alice Report more relevant now than ever?
Yes, hi, sorry for the delay. My screen just went black for a minute. So thank you. So why is the Alice Report relevant, more relevant even now? I think the first thing I will say is that the Alice Report is really putting a face on, or I should say COVID-19 is really putting a face on the Alice worker, right? We now know and understand that Alice workers are these essential workers that we've come to rely on, especially during this pandemic. You said that earlier. And so these are people who work on the front lines in critical service jobs, such as bus drivers and store clerks and mail carriers, et cetera. And these are individuals who work hard, but for wages that barely allow them to have to make their ends meet. And so I think that right now, COVID-19, as we see the impact on the disproportionate impact on Alice workers, it allows us to see, kind of see them in real time. And so that's what makes this report even more relevant. The other thing is that these workers are also more likely to be living in communities that don't adequately support their health. And so they may have conditions such as diabetes and hypertension and heart disease. And these health conditions put them at even greater risk for COVID-19 and other kinds of stressors on their health. And so the relevance of this report is that this Alice Report can be and must be the voice for Alice workers. It's got to be used as a tool that allows us to use the data to advocate for these workers. So, at KaiserPermanente, the reason that we signed on to be a funding partner for this report is because we believe that it's critical that as a society, we consider the underlying conditions, both the health conditions underlying, as well as the physical community conditions that are underlying that make Alice families perpetually vulnerable to illness, vulnerable to economic despair. And that's really why this report is so important at this moment.
Thank you so much, Celeste. I really love the idea of the Kaiser's focus on total health, right? The complete physical, mental, and social well-being, sort of person-centered responsibility, right? So I appreciate your lifting of that, and again, your partnership. So Stephanie, the racial and the economic equity is such an important part of United Way's work. We've had conversations, you and I, about that, right? And how can the Alice Report inform our work on race equity?
Right, so this is something we've been tracking for the last 10 years, and there are a number of groups that face discrimination, but we do know that the Black experience is unique, especially the history of slavery and the ongoing institutional racism. And I just want to point out that it's not just the criminal justice system that's been getting so much attention recently. There are barriers to financial stability for Black households within our public policy. You know, too much focus on policy alleviation or amelioration and not enough on jobs and wages. There are barriers in our education and health care systems that are, you know, have an element of pay to play. And there's even built into the Federal Reserve policy that looks at aggregate numbers such as unemployment and not breaking it down and seeing the huge differences by race and ethnicity in things such as basic as the unemployment rate. So as a result, we see Black households are much more likely to be ALICE. For the US, white households, about 42% have income below the ALICE threshold. Black households, it's 60%. And in Maryland, fairly similar, 32% of white households have income below the ALICE threshold, while 66% of Black households do. So low wages are actually a form of oppression, and it impacts a family's ability to live in a safe neighborhood with strong schools and community resources, including short voting lines. It limits their ability to afford a reliable car or healthy food and access quality childcare, education, and healthcare. And so as a result, it prevents a family from building up savings for an emergency, or investing in the future, such as higher education, small business, or retirement, and ultimately in building generational wealth. So as you can see in the graph, while Blacks are a small portion of the total population in the US, they're more likely to have income below the ALICE threshold, and they're twice as likely to die from COVID-19. And in comparison, white households represent a much larger part of the population, but a smaller portion of below the ALICE threshold and of impact on COVID. So these are important data points, and they're just data. They're not opinion, they're not skewed in any way, and that's where we need to start to address some of these inequalities. Like to give if you want a little more information, go to our website, unitedforalice.org, and you can drill down all this data and more by your state, by your county, by your city, at your zip code, and understand more what's going on in your own area.
Yes. And thank you so much, Stephanie, just for reminding us how important this report is in the sort of racial equity space, and where you can actually find this and other vital information about ALICE online. So thank you so much again, Stephanie, for that. And now I'd like to talk about a companion study to the ALICE report, known as the Benefit Cliff Study. The ALICE survival budgets and other information from the report were used to really inform the Benefits Cliff study. So this study, it really does show the impact of the loss of public benefits to working families that results from small increases in their earned income. And so this study was also made possible thanks to the generosity and commitment of KaiserPermanente. Thank you again, Celeste, for Kaiser's support, as well as the ABLE Foundation and the Annie E. Casey Foundation. So let me just take a moment to share a real story of what it means to fall off the benefits cliff. So between what she thought was a decent salary, $32,000 a year, and government benefits, Kelly, a single working mom, was just about to be able to make ends meet. She was well positioned. But when she got a raise that increased her yearly earnings by a total of $100, that's not a mistake, I said only $100 was her increase for the year, she lost hundreds of dollars monthly, over $300 monthly in SNAP food benefits, as well as subsidized health care for her young son, Christian. Things soon started to fall apart for Kelly. And then what she was dreading actually came to pass. After struggling for months and months with bills and expenses, Kelly was about to be evicted and her car was going to be repossessed. But fortunately for Kelly, a friend told her about a United Way program that could actually help and make a difference. But for so many families, the fall off the benefit cliffs can be truly calamitous, truly. And so I want to just ask you, Sarah, right? Tell us more about the benefits cliff. It really sounds scary when you think about a story, right? Like Christian and Kelly. And in many respects, it really is. Tell us a little bit more.
Yes, thank you, Franklin. The benefits cliff can be very scary. I mean, just personally listening to Kelly and Christian's story, I don't know what I would do in her situation, and it's not a unique case. We know Alice households are working hard, but they just often need a little bit of help, and so they may access public benefits, such as food assistance, or maybe a rental voucher, or help paying for their child care or accessing health care. And so they're just getting by every month on this combination of their earned income and the benefits. And then they get a raise, as Kelly did, or maybe they find a new job or a promotion. Say we have a retail worker who wants to move into management because it's more stable. It's going to pay a bit better. That's great, but the larger paycheck comes with a catch. They might no longer be eligible for their medical assistance, their rental assistance, or, as in Kelly's case, SNAP benefits and others. If the loss in the benefits, whether just the actual value of the SNAP benefits or the value of the benefits in general, because you don't have to pay for the health insurance or health care, is larger than the increase in their paycheck, they've hit a benefits cliff. So some workers realize it in advance, and they just don't take the new job or promotion. Our retail worker may opt to stay in her more volatile cashier position instead of moving into management because she doesn't want to lose her benefits. Others may not realize it. They take the new position, and then, as Kelly did, they only realize what happens when they have a sudden drop in the benefits that they need. Now somehow they have to make up that deficit. So working with United Way, the Schaefer Center for Public Policy set out to estimate if there were benefits cliffs in the state of Maryland and for what programs they would occur. We estimated the value of various means-tested benefit programs for different household types at different earned income amounts. We also looked at if Alice families could meet their basic needs with a combination of their earned income and benefits. I also just want to add the caveat that our study was done pre-COVID-19, so all of the findings in the study are for before that time, but what we're going through right now just makes it even more important. So among our findings, I want to highlight a couple for today. One is that yes, Alice households in Maryland likely experience benefits cliffs, although we didn't find some of the cliffs that we had expected to find in other states' evaluations. And that's because Maryland state lawmakers have instituted some policies to help address those cliffs. We discussed this in the report, but I also just want to note that some of these policies might be under threat because of proposed federal policy changes. Also, the sorry, I must stop moving for a moment there. So the policies may be under threat at the federal level and because of budget challenges at all levels of government. We also found that in many cases, households earning minimum wage can't meet their needs with both earned income and benefits. In a few cases they can, especially receiving rental assistance, but in many cases they need to earn well over minimum wage just to meet those basic needs. We found that two-parent households were especially affected in a few different ways. One is that families are usually eligible for extra benefits if they have an additional family member, and that's great, but it's the increase in benefits is not enough to compensate for the increased costs of another member of the household. There's also a disincentive to have both parents work full-time minimum wage jobs because the additional earnings, while substantial when you look at it on a paycheck or in a bank account, would result in the loss of several benefits. This makes their net resources, so when you add the earned income plus the benefits, only slightly greater than if just one parent was working. The difference is, it goes from about $1,800 gross increase to about several $100s once you take out the value of those benefits. Finally, with respect to race equity, we also looked at the demographics of who's receiving benefits in the state. And as a state in the state as a whole and in several jurisdictions, Black individuals and families were overrepresented among program recipients compared to their share of the population. This is also reflected in the information Stephanie just shared about 66% of Black Maryland households being under the ALICE threshold. They're still in some cases overrepresented amongst the policy or program recipients. This suggests that the benefits cliffs and any changes to the program, such as eligibility or benefit levels, likely has a disproportionate impact on these state residents.
So thank you so much, Sarah. I just want to ask you, just as a follow-up, when you think about the various findings that you've seen, you listed 3 key ones, but there are so many, obviously, in the report. But which finding was most shocking to you, or an aha moment as you were going through the report, helping to compile? Anything you could share for our viewers and participants today that was just sort of real shocking, surprising fact or finding for you?
You know, there were actually a lot of shocking ones. I think the main one is the state is making progress on dealing with this issue. And so that was, as somebody who just moved back to the state, that was really great to hear. But it is concerning because it's all, especially with our current budget problems, we don't want to see that happen. And also just reinforcing, I apologize because my 2 main ones are the 2 of the ones that I put up on the screen.
No worries.
It's just the effects of 2-parent households and what they have to go through and what benefits cliffs they might meet as well.
Yeah, thank you so much. And Stephanie, I want to just ask you sort of a follow-up as well. When you think about the ongoing nature of the ALICE report and how it dovetails with this benefit cliff study, any sort of key things you would highlight or lift relative to the value of both the benefit cliff study as a companion to the ALICE report?
Right, so the benefits cliff is a real conundrum that hits a central group of ALICE families. And you did a great job providing some examples. But it also highlights to me how far below the ALICE threshold those benefits are offered. So while there are a significant number of ALICE households who are helped with public assistance, there are many more who are not eligible because they earn above that threshold and so are struggling on their own. And so part of that's because we don't have the right measures embedded in government to assess financial stability. And I think that it's really important, the work that you all are doing of highlighting this so that people understand and give ALICE a name and recognition.
Thank you so very much. Any comments from you, Celeste, as you hear from Sarah sort of sharing the findings and what the benefit cliffs experience is for people like Kelly, right, and little Christian? Any comments you want to add on to their comments?
Yeah, I mean, I would say that this is clearly a public health issue, which is why KaiserPermanente took interest in this. You know, we're talking about economics, but economics have such a deep impact on our ability to live and thrive, right? And so, so when I hear about ALICE families that are struggling in the first place, then are put in this precarious position of having to make decisions about incremental income increases in order to maintain some level of you know, some degree of ability to keep their family, to sustain their families, it's ridiculous. It's, you know, I mean, I can't really think of a better way to say it, that when you have to make a decision about whether to take a pay increase or whether to take a new job because you're afraid of losing benefits. So we've got to do something about that. These are systems that are meant to help, but instead harm, essentially. So, you know, when I think about the work that we, KaiserPermanente, are doing as a public healthcare organization, it's really to improve health and well-being, right? Because we've got to be able to think about what really produces health. It's not just a visit to the doctor's office. It's not just having health care. It's really having access to the socioeconomic conditions to help us to thrive and to help our communities and our families to thrive. So one of the things that I guess I will say as a call to action to those of us who are in positions of influence is that we've got to do three things, I think. One is to increase economic opportunity for people so that they are not, individuals such as these ALICE workers are not living on the edge continually, where they are, they're not making a living wage, bottom line. And so, this idea that families are reliant upon public assistance has got to stop. That's one of the first conditions that we have to try to prevent. And then the second thing is, we have all kinds of social needs in our communities. And within healthcare at our organization, we've just launched a network of social service providers that helps us within our health system to address social needs. So what does that really mean? It means that when you come into a doctor and you're being asked what's wrong with you, what are the health needs that you have, you're also being asked, what are some of the other things that are preventing you from being well? And it may be hunger, it may be a lack of housing, or something that is not seemingly within the purview of a health system, but can be if we have the right providers to refer our patients to. So this is a network called the Mid-Atlantic Community Network. That is a social service providers network that allows KaiserPermanente and community clinics to refer patients to social services to meet some of those unmet needs. But again, we can't stop there, because the unmet needs will continue to exist. So we've got to also influence policies. And that's one of the reasons why it was so important for us to join United Way in the ALICE report and Benefits Cliff Study publication, because we want to be able to influence policy, use our resources, use our influence to say, this is not right. These are policies that need to be fixed. Let's join together and try to advocate for policy changes so that these conditions don't continue to perpetuate, again, poverty and living on the brink, essentially. So that's really what I would say to what we've heard today.
Excellent. 3 points. Thank you, Stephanie, for lifting what you lifted, and Sarah for explaining the findings. We really appreciate that. Now more than ever, though, action is needed to assure, right? Just to your point, Celeste, that health and well-being of far too many families and individuals in our region who are juggling the bills, right? They're just trying to stay ahead, and they're just really trying to work hard, making decisions about, what to pay. That's really unbelievable. What to actually pay to get through the week or the month, often with precarious results, right? So United Way has, as many of our 257 people on this line, many of you know, we have worked long and hard with people in the ALICE population. And since the pandemic, we've stepped up to really meet their growing need. And we have thought long and hard about the needs of those who have suddenly become part of this group we're talking about. And so we're in this for the long haul. As always, we will continue to be. We've been helping people in this region for 95 years, particularly during crises. So looking ahead, we have a multi-phase response to help families and area nonprofits recover and rebuild, right? Not just response, but recover and rebuild along the way. Our focus moving forward that will help ALICE households, it includes the following things, right? And one of which you've already touched on, Celeste, but providing immediate assistance to help people cover basic living expenses. It's really paramount. Secondly, offering access to affordable childcare for parents returning to work. In fact, in many of our counties in Maryland, that's either the number 2 or number 1 household expense, childcare that's affordable, right? Thirdly is conducting financial planning and management of federal relief funding, right? For low wage earning families. Critical deal. And to your point, Celeste, advocating for public policy to better support low wage earners, those in poverty, and those who are undocumented, right? And then lastly, working with our neighborhood leaders, right? We have this belief in United Way that leaders are everywhere. They're in the boardroom, but they're in the block. They're in all of our neighbors. Our neighbors are leaders, right? So how do we continue to work with our neighborhood leaders and other partners to create jobs in innovative sectors? And now I'd like to hear from you, our audience, right? We're working to build a committed community of folks who are taking action to help Alice. Not just talking, but taking action to help Alice. We want to spread the word about this population. It's so important to advocate for this population and the precarious situations that each of them find themselves dealing with every single day, and what's needed to create a real change for each of these individuals and families that make up 39% of Alice households in Maryland. So we have prepared a quick survey where you can tell us what you're doing as a business or community leader to assist Alice. How does that sound? There are some examples to help guide your responses, and where, if you like, you can share your Alice story. So the survey link is in the chat. Please feel free to cut and paste it for later, or look for it and a link to both the full Alice report and the benefits cliff study in our follow-up email to this event, right? So the link, uwcm.org/share your story. And so Celeste, tell us about some of KaiserPermanente's efforts to help hardworking people impacted by this pandemic.
Yes. So there are a number of things that we are doing across KaiserPermanente to help individuals who are challenged, economically challenged. One is supporting jobs and job creation, and we're doing this in two ways. One is through job training and creating pathways to jobs for youth and adults. We've got some great programs that we're running in Baltimore and throughout Maryland that are supporting individuals, as I said, in creating career paths starting in high school, and one is called P-Tech. And then the second one is we're supporting small businesses. Small businesses are economic drivers in communities, and it's really important to help these businesses who are strapped, more strapped from COVID-19 to survive. We've heard, or I've read in the New York Times, there was a great story recently that shared that about 40% of Black-owned businesses may not recover, may not come back from COVID-19. That's huge. So we at KaiserPermanente are working to shore up some of these businesses. We recently announced a big investment of $60 million across our markets to support up to 2,000 small businesses over the next year to help them to become stronger and more sustainable. So that's one way. We're also supporting housing, creating and preserving affordable housing. As a healthcare system, that's extremely important because housing first. If you're not housed, you can't be healthy. Those two things just don't work together. And so, creating more opportunities for people to be able to live in affordable housing helps economically. And then I mentioned the Maryland Community Network, the Mid-Atlantic Community Network, which again is a social service network that helps doctors and social service providers to interact. We now have 130 service providers, social service providers within the network. So that's really going to help care providers to be able to better serve the total health of their patients. And then lastly, as I said, really helping to move policy, to be at the table, to think through policy recommendations with you all and with others, and to make some recommendations because we are a large institution. We ought to be able to use our influence to do that. So those are just some of the ways that we're thinking about, how not only thinking about, but taking action to support Alice families and those who are really struggling.
Thank you so much, Celeste. I mean, I have actually heard it said that housing is health, right?
Yes, yes.
You can't have health without housing that's safe, affordable, clean, right? So
Yep.
Thank you for sharing. And thank
Absolutely.
all of our panelists. We so much appreciate everything you have brought to this conversation. Stephanie, thank you so much for being a long-standing supporter and champion and voice, national voice in the 22 states where Alice is present for this work. And thank you so much, Sarah, locally for helping us to stand up this benefit cliff study. We really appreciate all of your insights that you shared today about the impact that Alice and the benefit cliffs actually has on the health and well-being of members in our community, and the role that race plays, right, in preventing so many people in our region from achieving financial stability. So to our 252 participants that are still on the line, thank you for hanging in here with us. If you have questions or need more information, the panelists' contact information will be on your screen if it's not already, as well as a link where you can find the ALICE report and the Benefit Cliff study information, right? Thank you so much for those who are commenting that this was excellent, it was good information. We appreciate that. So we really want to get to a place, right, where we have a few minutes for questions. We were hoping we would have a few minutes at the end. We will try to get to them all. We've been working behind the scenes to compile as many as we can to be able to respond. So thank you so much for those who went in and entered questions. We'll now take a few moments again before we close out to address some of the questions. So Susan, can I get the first question if you have one? I think the first one here is, what can I do as a manager other than increase salaries to help my employees who are ALICE? That's a great question. Here are just a few ideas that I would just sort of throw out to that one. First of all, you could consider, right? It's not always possible, but you could consider offering flexible or predictable work schedules, right? Depending on the job of the individual, what's required. You may not always have that flexibility or wherewithal within your company, but if that's possible, you certainly can do that. Another thing is provide some sort of clear career pathway for your employees. It becomes problematic in some environments, we get that, where it's more difficult to nuance that, but if you're able to do that, right, that's a great action item you can take. Another one that comes to mind is you could consider subsidizing employee cell phone bills. I know lots of companies have been doing that, advocating for that. If you have say a gym membership, right, and it costs 20 bucks a month, maybe you pay as an employer $20 of that as a subsidy to encourage health, for your workers, if it's a part of your building. Another one that comes to mind is maybe advocating for on-site childcare, right? So there's a litany of things that can be done as it relates to the workers, right? Thanks for that question. Do I have a follow-up or another one? The one that I see is, what does it mean for our region, right? What does it mean to our region if so many people are struggling, right? Surely there's a large number of ALICE households that have trickle-down effects. And maybe Stephanie, I'll maybe throw this to you, not putting you on the spot or anything, but maybe kind of talk about the economic impact and seeing sort of seeing it right now with COVID as those earning low wages have their jobs. Unfortunately, I've heard so many people say this. They've had to furlough, cut hours back, right? Massive unemployment and a host of other drains on their resources that they, prior to the pandemic, they were relying upon, right? So maybe talk to that a little bit from your perspective.
Absolutely. It's a huge worry. It's like watching a train wreck in slow motion. We know the impact that this will have on families. It's devastating when you have little or no savings to have your hours cut back, to lose your job altogether. So we're quite worried now that the eviction moratorium is being lifted, that there will be more homeless families. And I like the way the question was asked, that the impact on the whole economy, that we were worried about the stability of the economy before COVID hit. It's not a prosperous growing economy when 40% of folks aren't good customers. One of my favorite sayings is Henry Ford paid his workers enough so they could buy a car. That we need workers who can participate in the economy and propel growth. And that's the opposite of that is happening now. So we have great concern on the added pressure for public assistance programs. We see a lot of ALICE families going into the system for the first time. As I'm sure everyone's been reading in their local press, food banks are overwhelmed. That's often a first place that families turn to. So all the warning signs are there. And I think we're in for a tough ride. It took 8 years for many families to recover from the Great Recession. And we see a lot of seniors without savings having to retire in ways that they had not originally planned. So we're expecting, that kind of timeline for the recovery from the COVID recession.
That was very helpful, Stephanie. I thank you so much for that perspective. Another question that came in was, what can I do to support families who come into my library who are ALICE? So what resources can I connect them to? One simple response to that would be, you may or may not be aware of this, but we have a 211 United Way helpline that one of the main things they do is they support individuals who call in or text in or chat in to find resources for their issue. If something dealing with utility concern, food insecurity, housing, transportation, childcare, legal, you name it. That's a first gateway that I would encourage folks who are on the line. If you haven't already referred workers who are ALICE to 211, 24/7, 365, more than 6,500 different resources that are available on this platform. We have largely masters prepared information referral specialists who are manning this particular line and have done so for over a decade. Every year, over 100,000 calls for Central Maryland, over 400,000 throughout the state. So it's an excellent resource to refer people to. Thanks for that question. So anything you want to add to that as resources? Yes, we're just going to ask. Thank you.
Well, there was a question earlier that I wanted to address where somebody put in the chat that we have to stop creating jobs that are not, that still keep people essentially struggling. So jobs that are not living wage. And I want to put a fine point in that, because it is absolutely right that it's not enough to simply create jobs. They have to be jobs that that can sustain families. And so, as we're thinking about how to help ALICE families through advocacy and other, we really do have to consider, your first question of this panel was, or your first slide was, what does it take to live? What does it take to live with a family of 2, 4, 6, or whatever the size is? And we need to be creating jobs and putting people in jobs that are going to offer meaningful wages. And some of that is, mentoring people who come into entry-level jobs so that they have that opportunity to rise up. And you mentioned that, Franklin, is one way that you can help your workers, is to ensure that they are on a career path, not simply on a path to keep a job, right? And so I think that's one of the most important things that we can do, is to create career paths and create pathways that really do allow people to have jobs that take them further along the path of wealth.
That's excellent. And one of the things I was just sharing with someone the other day, there's a person who called our 211 not having monies to get to an interview, a job interview. So the person who asked the question about, if someone shows up in their library, they walk to the library, they're checking resources, they'd like to have some knowledge around how can they get supported or subsidy with transportation to a medical visit or transportation to a job interview. 211 would be able to partner with our Lyft partner and provide a complimentary ride as a result of various corporate partners who fed into building a certain amount of money up so that we have cover for those individuals who need literally to go from their home to a doctor's visit, right? From their home to a training session, like physical therapy, whatever it is, they can call 211, get them plugged in for transportation support. So it's about action. It's about what can we do as a collaborative, as partners, to make a difference for these families. Any final words, either Sarah, Celeste, or Stephanie, before we begin to land this plane, as they say?
Well, Franklin, if I might, I'd love to put a plug in for the census and get out the count. Our ALICE work relies very heavily on that, and the more accurate the census data is, the better everyone's work that builds upon that will be. And it's so important that everyone is counted.
Yes, yes. There is one question someone wanted to lob to Sarah. There was a bullet regarding 2-income households being de-incentivized. So does this impact couples' decision to marry, thus the high rate of single-parent households in the Black community? Is that a factor?
Well, thank you for the question. That's actually beyond the scope of our study, was to get to answer that. But I think you could make the assumption that there's people who come to that realization that they'll be hurt by marrying or cohabitating, and so choose not to, in order to maintain receiving benefits that they need in order to live.
Yeah. So, Celeste, any final words before I sort of make final remarks?
Yeah, I really just want to thank United Way for taking the step to put out these extremely informative reports, eye-opening in many regards, for putting a face on Alice workers, and for helping us to understand these real conditions that exist that really prevent people from thriving. So I just want to thank you for stepping out and providing the data. Data speaks volumes, and we appreciate that.
Absolutely. And we thank you so much again for being one of our panelists. Lots of prep, lots of time just combing through what's important to share and convey. And thank all of you who joined us today, all of you who hung on the line. I think the number now is 211, so many still on the line. We hope you enjoyed the session. We hope you'll attend the next in our Realities of Inequity series, the need for affordable, accessible childcare. What an important topic. That will be held on August 19th. And you should have received your invitation already. So we hope you can join us for that wonderful session. My thanks to all behind the scenes who've done a great job today, keeping this flowing and moving. Thank you for your patience today, everyone who joined. Hopefully it was helpful. Have a great afternoon. We'll see you next time, hopefully, at the next session on August 19th. Thanks, everyone, so much.